Let's keep moving. After a joint replacement, there are some do's and don'ts. The therapist will go over specific instructions before you leave the hospital, and general information is in the handbook. First, a few don'ts. For the first 2 weeks, no driving. Typically, there's an appointment with a surgeon around 2 weeks after surgery, and you can talk about driving readiness and return to work. Even if the surgery is on the left leg, driving is a risk, especially while on prescription pain medication. Don't lift anything over 50 pounds on a routine basis ever again. Joints wear out more quickly with excessive lifting of heavy weights. This may include pets and grandchildren. That doesn't mean no activity. Take it slow and steady and do the recommended exercises. Some surgeons prescribe home health physical therapy or outpatient PT. Talk to your therapist about a gradual return to using equipment in a gym facility or at home. The surgeon may prescribe precautions depending on the joint and type of procedure. For those with a new knee, don't place a pillow directly underneath the bend. It might temporarily provide comfort, but when the knee stays bent over extended periods of time, scar tissue forms so the leg may never fully straighten, which will affect walking and standing. Place the wedge under the leg to keep the knee straight. Use the wedge as much as tolerated while at rest for the first 2 weeks after surgery. For some, it's all night. For others, it might be 30 minutes at a time. For those with a new hip, the precautions prescribed by the surgeon vary, and some patients will not have restrictions in movement. If there are hip precautions, the therapist will review these before discharge. Now let's move on to what to do, how to get the home ready, and how to be safe during recovery. Do make sure all the pathways are clear, remove rugs, cords, anything that might get in the way of going to the bathroom, bedroom, or kitchen. Plug in night lights to illuminate the path. Keep the most used items at waist level, nearby, to avoid overreaching, twisting, or falling. Take extra time for everyday tasks like getting out of bed, dressing, or taking a shower. Rushing affects balance. So does mixing alcohol with prescription pain meds. Keep pets in another room or restrained if they like to jump up when excited or run around. Preventing falls is really important. If a walker or crutches are used in the hospital, use at home for at least the first 2 weeks. Support may be necessary when using the stairs. The person helping stays on the stairs below the patient. Then it's up with the good leg and down with the bad. While going upstairs, lead with the non-surgical leg, and going down, start with the joint replacement. Any and every time there's a fall, call the surgeon. Even if it seems like it's not a big deal, every fall is a risk for complications that may go undetected if the surgeon is unaware. Keep the guide to recovery in a handy location and refer to it often. Always call the surgeon first with any questions or concern related to joint replacement. Remember, the surgeon is your partner in care. Don't hesitate to call. When you call, the surgeon may recommend a visit to an orthopedic urgent care location, which is preferred over the ER because it is less expensive and limits exposure to germs. If an ER visit is necessary, don't forget to take the joint replacement card with you. If the situation is life-threatening, call 911. Please watch the other joint replacement videos for additional information. Recovery is a process. Be engaged and take care of yourself every step of the way.